Good morning, Grapevine Health family. This is your girl, Dr. Yola, out here making sure that we come to the community to answer all the questions, right, in a way that connects to the priorities of our community. Right now, I get the privilege of being out here in Southeast Washington, D.C., asking families if they have any questions about the COVID-19 vaccine for our pediatric patients. As a pediatrician, as a public health expert, and even more importantly, as a mommy, I am out here to make sure that we answer any and all questions that families have about this vaccine since it was released or approved back in November. We're taking it to the streets, y'all. Ask your questions. We're about to go ask ours. What is your opinion on the COVID-19 vaccine for yourself?
Myself, I don't really. It's a lot of rumors going on about this, so it's a iffy situation. Like, I don't know what to say. I don't know what to say, yeah or no, because we had vaccines before.
Right.
You feel me? When we was kids, we had to take vaccines.
Right.
You know what? Next year, I'm prepared to take it next year.
I hear you.
This year, I'm wearing masks. I don't have a problem with it. I always wear a mask. I don't visit people anymore.
Right.
From last year, I don't visit anybody. Nobody comes to me.
Yeah.
So I'm just like, you know what? My circle is only 3 people.
I hear you.
My husband, my daughter, and me. That's
You're
it.
keeping your COVID circle tight.
That's right there.
I don't know. I'm kind of wait. I don't know. I'm really trying to wait to see how it play out for real. I don't know. I'm kind of skeptical for real.
So it sounds like you, one, are protecting yourself, doing all the public health things, right? Keeping your COVID circle tight, always wearing your mask. You're not really leaving outside the home.
I'm not even going to the restaurant, nothing. I'm not doing that.
Barely even the grocery store, right? Now, how do you protect your little one with her being at school?
She wears mask.
Okay.
So she wears mask. I always tell her, even though your friends are vaccinated, you always have to wear a mask.
Yeah.
She doesn't have a problem with
Good.
it. But where I'm struggling is because she's like, well, Mama, I cannot visit anybody. I cannot do this. I cannot do that. I say there's always time for everything.
I'll be like, well, you going anywhere? You going? She'll be like, nah, I'm not going anywhere. Whatever. I don't want to catch COVID. But you got the shot though.
Right. Right.
If I'm going to be not going nowhere.
Right, then why am I getting the shot?
What I take the shot? Well, you trying to tell me to take the shot?
No, I can't live. I can't go back and live my life. Even though I got it. No, I got you. I got you.
So it's just stuff like that, and it's just like why a lot of things play on it too. You know what I'm saying? Like whole Tuskegee and all that type
I hear
stuff.
I hear you.
You feel me? So I really feel like it'd be better off if. Like the only way I feel like our people really want, like really take the shot, is if they like really acknowledge what happened. Like you know what I'm saying? Like, look, we know what happened, and say it happened.
Yeah, full public acknowledgement.
But this
I got you. I got you.
Take the shot.
So talk to me, my love. I know for a lot of parents, as a pediatrician and as a mommy, I had to go through the same process in terms of thinking about whether or not I got my kids vaccinated. What are the things that you think about when you had to make that decision?
See, I think about because they could still be a courier, they could still get COVID. So my whole thing is, what's the point of the shot if you still could get it?
I look at the news a lot, and they be talking about this. Some certain people say when they get it, they get sick. Some people say when they relatives had got it. One person told me their cousin balls had swole. I'd be thinking about the side effects. Then again, I'd be like, should I or should not? I just haven't, I don't know.
Right. No, I hear you.
When I became a parent, I've been a father for 35 years.
Wow.
I became a father.
Yeah.
And I took my son to the doctors to get his immunizations. And I calm him down so that the doctor comes in, a stranger, and then stabs him, and then he gets so frustrated and upset because he doesn't know what's going on. He doesn't understand the process.
Right.
So I'm saying to myself, mentally, what am I doing to my child? And is there a way for me not to do this? Is this an absolute necessity?
Right.
And then I realized that it wasn't. Then I didn't.
I got you. You mentioned that you battled COVID back in June.
Yeah, back in June.
Now talk to me, with having your own experience with COVID, how does that does that influence your decision at all in terms of getting your kids vaccinated?
It definitely did. It definitely did, because the feeling. And I didn't mention that they had it too.
Wow.
I didn't know.
Yeah.
I didn't know I had it. So.
Yeah.
from doing this. So what he doing now? The camera work and all that.
Yeah.
Been around people, just taking it for granted.
Yeah.
Really can't. I really thought COVID was fake at first.
I got you.
And all that until, boom, it hit me.
Yeah. Now, what do you think they could tell you to sort of push you over from being in it, thinking about it, to being like, yeah, I commit?
Well, if they would tell me, I would believe it that it's accurate. You know what I'm saying? I would believe it, but it's just that I don't know. It's just that 1% on my mind.
Yeah, that small chance that your child will be the one where something's gonna pop off and happen.
Exactly.
I got you. Now, one of the things, particularly as Black parents, that we have to be concerned about is how much more our children have been affected by COVID than other children. So how do we balance between protecting them and doing what we need to do for them so that that's not the case? How do you make that decision, especially when we see, especially here in DC, more of the children who were infected were Black and brown?
Well, I guess you would have to first get information.
Right.
Get an understanding of what it is that you're afraid of.
Okay.
Because if you don't want to do something simply because other people don't want to do it, then you don't have enough information.
I got you.
So the first thing is to get the information to find out exactly whether you're pro or con against it. And then make a fair assessment to what best suits you as a person, and then your child secondly, because you're responsible for your child.
Right. We hear this term called breakthrough cases. I think it's important, what I explain to my families, and this certainly isn't to convince you to get her the vaccine, but just to help answer that question, is the vaccine originally was designed to do two things. One, to make sure we don't get super sick, and the second, to make sure we don't die, right? So there's still going to be a likelihood that you get it, but you don't get as sick as you would. You see what I'm saying? Because the majority of people in the hospital right now are those who are not vaccinated.
Yeah, and I'm thinking about getting it for her because she has real bad asthma, and I know it messes with your breathing when you do get COVID.
Yeah.
So it's something I'm thinking about, but I'm not too sure yet.
I hear that a lot from families. They're like, I'm not going to be the first, but I won't be the last. You hear what I'm saying? Exactly I hear that a lot from families, and it's a reasonable way to sort of navigate through it. The only concern that I have as a parent, right, I have a 9-year-old, is if I wait, is she going to get caught up with COVID? Exactly. That's how I sometimes have to, like, I've made a decision to get her vaccinated. She's going to go when I go get my booster next week. But I have to think through, even if I waited next month, next year even, what is the risk I take with, if they've gotten it before, them getting it again? You see what I'm saying?
That's what I'm saying, man. Like, I don't want it to be too late.
I hear you. It's such, as a parent, it's so hard, right? We have been out here in Ward 8 in conversation with our community, really connecting with parents and caregivers to get a better understanding of their opinion on the pediatric COVID-19 vaccine, what their questions and concerns are, and where they get their information. Especially as Black parents, how do they make decisions that are in the best interest of their children, taking into consideration the information available through the media, social media, and their trusted sources. We have asked questions, answered questions, gotten our dance on, really enjoyed ourselves in connecting with community. Come out, get your questions answered. Thank you to Dr. Lisa Fitzpatrick and the Grapevine Health staff. Dr. Yola out.